Good morning to you all, and welcome to the fourth lecture of the 2020 Palliative Care Lecture Series. Hospice New Zealand would like to thank and acknowledge Cancer Research Trust New Zealand for their generous support and funding to deliver these free lectures. The lecture today will be recorded, and it will be available on the Hospice New Zealand website. Please be aware there will be an opportunity for questions at the end of the presentation. We would like to introduce our guest speaker today, Nolan Hodgson. Nolan is a registered music therapist and has been practicing for the past 5 years. Nolan has been with Hospice Waikato since 2018, working with children, adults, and often their family members alongside them. He has also worked with groups and individuals in mental health settings, people with dementia, and with children. Nolan, please go ahead.
Thank you, Rochelle. All right. Tuatahi. Tēnā koutou katoa. E mihi atu ana au ki te kahu pairuri o Aotearoa me ngā kai whakarongo e noho haumaru I te kāinga I roto I te tūārangaranga o tēnei wā. First, I'd just like to thank Hospice New Zealand for giving me this opportunity to speak about the work that we do as music therapists in palliative care, and acknowledge all of you listening into this lecture this morning, unprecedented times. I hope you're all safe and well, whether at home or at work. Today is my first day returning on site since March to deliver this lecture, and I hope that many of us will similarly be able to return over the coming weeks. Well, I have been continuing to work using Zoom during the lockdown. Many of the techniques I'll be talking about today do require working face-to-face, and I'm looking forward to getting back into it. As you can see, I will be talking about pain and music therapy with a specific focus on palliative care today, and also about music in general and pain management, as I realize we don't all have access to registered music therapists in our workplaces. So, thank you for joining me. I will begin with this waiata, Aio Morito Aio, which was composed and generously gifted to Music Therapy New Zealand by Te Mana Aroha Rolo. This waiata was given with the intention that we can use it both to support others and to support and sustain ourselves as we encounter so many different and sometimes challenging situations during our work, as you'll see from the lyrics which are translated here. So I'll just do my setup and grab my guitar and play this for you. Na manoa inyangaro ai monoa to waila te a te awi no te paia te mauri o ya mauri no ki te haura ai o mauri Alright, so just another short introduction to who I am. I'm a New Zealand registered music therapist and graduated with my Masters in Music Therapy from Te Koki, the New Zealand School of Music, in 2015. As mentioned, I previously worked in adolescent mental health and alongside students with diverse learning needs. For the past 3 years, I've been working with people living with dementia, and more recently with children who have experienced high levels of adversity or trauma. I've been here at Hospice Waikato for the past 2 years, and I work here for 3 days a week. I work with adults and with children through Rainbow Place, which is our pediatric palliative care service. and I work within the family services team here alongside our counsellors, social workers, spiritual care coordinator, and massage therapist. So I'll just give a brief introduction to music therapy, as I know many people have not worked alongside music therapists before or are unaware of what exactly it is that we do. The current Music Therapy New Zealand definition of music therapy is the planned use of music to assist with the healing and personal growth of people with identified emotional, intellectual, physical, or social needs. So essentially we are trained and registered professionals who use music and musical activities to promote people's health and well-being. We play live music, often with the involvement of the people that we are working with. However, they do not need to be musicians or have any musical background or history to participate. We also conduct research into the potential benefits of music therapy, and there are now decades worth of research that supports and guides our practice. This body of work continues to grow, and there is published research to support the use of music therapy with people experiencing all of the symptoms that I have listed here. As an organisation, Music Therapy New Zealand is also a part of Allied Health Aotearoa New Zealand, and like many other allied health professions, the work that we do is evidence-based, and we maintain our registration and practicing certificates through regular professional development and ongoing supervision. As you can see from this slide, I receive referrals for a broad range of different reasons, and I'm very fortunate here at Hospice Waikato to work alongside a fantastic multidisciplinary team who send me these referrals. I can come from both my own team and from the different medical nursing teams that I work alongside. Off the top of my head, I would say most of the referrals I receive are for the psychosocial listed here, and referrals for the physical and neurocognitive symptoms are probably more common when I'm working within our inpatient unit, where people's symptoms can be more acute or their situation a bit more unstable. It's important to note that the way we work as music therapists is client-led, and we respond to the needs and abilities of the individuals that we work with. So there is not a prescribed way of working with someone who is experiencing a particular symptom. If someone has anxiety or is feeling isolated, we don't just play a particular piece of music to help them through that. Everyone has their own unique relationship with music, and we need to meet them and find out what that is. We need to know what music they like and how they prefer to engage with it, so that we can tailor whatever intervention is most appropriate to their specific needs or circumstances. So what do we actually do in a music therapy session? Here are some examples of the different methods we employ, both interactive and receptive. Usually I work with patients individually. However, this year I have started a preschool group for children that I work with through Rainbow Place. I started this after receiving multiple referrals for children of a similar age and with similar needs, safe space where they can interact socially with other children and engage in musical activities that support their healthy growth and development. Actually, I've continued working with some of the participants of this group through the lockdown, and yesterday I had my first music therapy session where one of the participants was actually sitting on the potty for the first few minutes of the session. They were in their lounge at home and able to see the rest of us, and then they had the computer set up so we could see their face and they could continue to participate. So that was another milestone achieved through the wonders of the internet. Back here at Hospice Waikato, I have a dedicated music therapy room that I'm sitting in now to run my sessions in. It's got a piano, drums, guitars, keyboards, and a range of other assorted percussion instruments that we use. I very often work with people in their inpatient room as well, and also visit patients at home, at school, or within aged residential care facilities. The sessions themselves are always completely different and completely dependent on who I'm working with. After receiving a referral, I meet with the patient and conduct an initial assessment, working alongside them or their family sometimes to determine what we can do together that will be of most benefit to them. The patients themselves lead the sessions, as I am directed by their preferred music and any musical activities that they are willing or able to engage in. This can change over time as their condition improves or deteriorates, and as their level of consciousness changes as well. The sessions can be passive, where they simply talk about music or reminisce over concerts or meaningful experiences that they have had or shared with loved ones in the past. I always remember one session I had last year with a man from a small town here in the Waikato who was quite isolated and didn't have a lot of friends or family spending time with him, and was doing okay, but was not really engaging with much of the team here. And I received a referral to go and see him, so I went and met him and found out that he had lived in London in the early 70s, I think it was. And we just had a chat for about half an hour about all of the different concerts that he had been to, and he could remember all of the different bands that were on the bill and who he went with and everything that happened. And it was just such a huge part of his identity and who he was, and how he saw himself. And yeah, we connected really well just through that conversation. I think I played a couple of songs, but it was more just giving him that chance to share who he was and a bit of his history. Other sessions, people might like to hear me play a particular piece or style of music, and I do my best to accommodate this, or often I need to learn something appropriate for a future session. Other times people can be much more active and they sing, play, or improvise on a particular instrument. I've also worked with people who choose to compose their own songs or lyrics, and often I work with family or friends who are present as well. And many times they will participate by singing or requesting songs as well. This can really change the atmosphere in a room. Often songs will reference or stir up emotions in people that they may be feeling but are unsure how to express, and their participation in the music can allow or encourage that to happen, or just let those feelings or emotions come out and be expressed in a safe and positive way. It's also a wonderful way to build a therapeutic relationship with someone. So if I can play or sing or even just talk about an artist or song that they really connect with, or just sit and spend some time singing something familiar with them while they're away from their home and their loved ones, it can have a really significant effect on them. I'll get into more of that further on. So, pain, what I'm here to talk about today. I need to acknowledge Dr. Cheryl Dallaire, who is a music therapist that I'll speak more about this morning, who introduced me to many of the concepts that I'll be talking about related to pain and some of the more different nuances of pain. So I'll start first with the concept of total pain, as Dame Cicely Saunders defined the concept of total pain as the suffering that encompasses all of a person's physical, psychological, social, spiritual, and practical struggles. So the idea that pain is not just our physical pain and that direct consequence of a physical injury, but using these biopsychosocial models or holistic health models that acknowledge that all these other aspects and all of these other domains of our lives impact on us and our health and well-being. and we can feel pain. We can feel emotional pain, spiritual pain, psychological pain. They all affect us in different ways. Also, culturally, we have different understandings of pain, how we express it, the different words that we have it, or different cultures have particular rites of passage that may involve painful procedures or experiences that are seen as necessary or part of some progression towards maturity. Traditional Polynesian tattoos are a good example of this, and I know friends who have got moko kauai tattoos on their chin, and they have requested specific musician friends of theirs to be there and be performing and be singing while that procedure is being undertaken. So how we grow up and the culture that we live in does determine how we feel and how we respond to pain. And I need to talk about how these understandings of pain, that idea of total pain, and these biopsychosocial approaches that we use in palliative care resonate really well with the holistic understandings of health, or more ecological approaches to health that we use in music therapy. As I said earlier, I'm often working with the psychosocial symptoms that our patients are experiencing, and because the team that I work with are so aware and are always looking out for what is happening in our patients' lives beyond purely the physical symptoms, that means that I get good referrals from them. And yes, the ability for us in music to engage in the spiritual or social dimensions of a person's well-being are really valued, and the use of music can have a significant impact in these areas. I want to talk quickly about these two theories of pain, the gate control theory and the neurometric theory of pain developed by Ronald Melzack. The gate control theory of pain proposes that a mechanism in the spinal cord acts like a gate that inhibits or facilitates transmission of pain signals from our body, from the peripheral nervous system into the brain. Only so much information can get through this gate and go on to be processed by the brain. So the stipulation is that if we can therefore introduce some other stimulus, such as music, then this will inhibit the transmission of the pain signal and help to reduce the perceived pain. This theory was developed, I think, in 1965, but more recently there's been this neurometric theory of pain developed by the same person, because the gate control theory of pain didn't explain how things such as phantom limb pain or chronic pain could occur, as there are no nerve fibers when you've got no limb there to send information through to the brain. So this neurometric theory proposes that sensory information stimulates particular patterns of activity in specific areas of your brain. These develop into neurosignatures that can be activated without the presence of the initial sensory stimulus, and this may help to explain what is occurring when people are experiencing chronic pain conditions or phantom limb pain. The relevance of this to music in this instance is that music can also influence activity in these same areas of the brain that are activated during the experience of pain. And I've got these listed here in the nervous system, these 5 different processes that are happening while we are experiencing pain. So there's where the actual location is, the sensory location. Our emotional response, we respond emotionally to pain, and that is also affected by our memory of past experiences of pain. Our evaluative judgments, how we actually think and choose to respond to pain, because we can all respond in different ways, and the actions that we make in response to it. So these can be automatic, as if we are being burnt, we will automatically move our hand or our part of our body that's being burnt away from that. We can make cognitive, conscious decisions to help us deal with the pain. I just want to talk about music therapy entrainment, which is where I learned a lot of this about pain. And just in February this year, Dr. Cheryl DeLeo, who is a music therapist and a professor in the United States, she developed this program, and it is an evidence-based technique for pain management. And I just wanted to go through it quickly. I haven't actually had a chance to try it out in my practice because I learned how to do it in February. I did some education here at Hospice Waikato in March, and before I got any referrals to try it out, the lockdown occurred and I'm not able to do this remotely. So, how does music therapy entrainment work? First, we need to do a really comprehensive pain assessment, and this is most well suited for people with chronic or acute pain that is difficult to manage. So we need to know all about where the pain is, what it feels like, how, when it occurs, what is going on. The same sort of pain assessments that many of my colleagues here conduct when they're implementing other therapeutic interventions for pain. After this assessment occurs, then we move to the next stage where we compose together musical representations for exactly what their pain feels like to them. And it's really important that you match their pain as perfectly as you can musically. And so they are in charge. They choose the instruments that you use, and they direct you as to how it sounds, and you try some different things out until you refine how their pain sounds to them. Once you have that pain music organized, then you move on to what their healing music for them would respond in a healing way and help them get out of that pain. And we actually tried this out amongst ourselves during the workshop, and it was really profound, the transition from our pain music to the healing music. It did have a really significant effect on all of us who tried it, both as practitioners and as people receiving the treatment. Many of us weren't experiencing any pain at the time, so we had to imagine that or recall pain that we had experienced in the past. But some of us were experiencing pain at the time, and this did help. So how it actually works, the patient initiates the pain music using a hand signal, and they direct if we are matching correctly, or if we're not, they can signal to us to change the music in a way to match their pain perfectly. And as soon as it is, then they signal us to transition to the healing music. I found it really interesting that it was a non-verbal sort of process, and that we used these specific hand signals. Because I actually worked with a young man last year, a 6-year-old with a brain tumor, and during his last few weeks of life, he only communicated using hand signals. And it was incredible how much information he could convey just with a thumbs up and a thumbs down, essentially. As soon as I learned about this technique, I really realized that it would have been really appropriate for that situation. And this technique is used with children. The I'm sure I will be able to utilize it in the future. After we've gone through the process itself, then we engage in reflection, discussing how it went, how they experienced it, and reassessing their pain to ask if it has changed, if their pain at the moment following the technique has decreased. And there is a body of research evidence to suggest that this does occur, and this is a reliable method to assist people with their perception of pain. One thing about this method is that it does require us as therapists to be really cognizant of our own boundaries and be really careful when trying to enter in and resonate with someone's pain in such an intimate way. And also that it requires the person we're working with to really go into their pain in a really confronting and what can be challenging way. People have different strategies and different ways of coping with pain, from more avoidant or distraction-based strategies to more acknowledging and trying to work through pain. And this obviously requires people to really acknowledge their pain and really get into it and feel it before they can move out of it. I also just want to talk about how that feeling of isolation and when we're experiencing pain, we experience it as an individual. Nobody else experiences it. Nobody knows exactly what it feels like. So something like this technique allows people to share how that feels, or to feel that someone else understands or recognizes how that pain feels for them. And that can be a very liberating process for them. As I mentioned, it's not something I've worked with before. I've done before, but from the examples shared with us, can be useful with people who are experiencing chronic pain syndrome. Just initially to show them that their pain can be reduced, and there is a way that their pain can dissipate, or they can be released from that pain. And just by showing them that can happen, that can lead them on a path to developing other strategies and other ways of coping with their pain and getting on with it. Here I wanted to include this McGill pain questionnaire because it has all of these descriptive words to help us just describe how our pain feels to us, and I really wanted to include it as we can see how these may be expressed musically. And I need to thank my supervisor, Helen Dowswaite, who realized that we have all of these different musical terms which relate to the specific pain words or ways of describing our pain. And it's important to note that everybody experiences pain differently, and so everybody's composed pain music will be completely different. Other people may choose different musical terms to express these pain words on the left-hand side here. I just wanted to note that musically we do have the repertoire, or the sort of dynamics and different ways of expressing all of these different, this huge range of human experience. There are contraindications for music therapy and treatment, so they did not recommend using it for people with psychosis, borderline personality disorder, dementia, extreme anxiety, physical, emotional fragility, or obviously the inability to verbalize their experience of pain. It is used very successfully with children, obviously as long as they are able to verbalize their experience. And people need to understand the process that is occurring. to engage in NTE. So how music affects pain perception. I realize that we don't all have access to music therapists, so I can't work with everybody here at Hospice Waikato, and not everybody wants to work with music in regards to their pain, but I do encourage people to consider using music to assist them with their pain management. These are just some examples of how music does affect the pain perception. And for an example of, I think, the first maybe 5 or so, I worked with somebody recently who came to our inpatient unit from hospital by themselves, had a very painful head wound, and was experiencing a significant amount of pain. We were not able to talk to them, and they were not responsive, or they didn't trust our medical team to intervene. They didn't appear to be aware of where they were or what was happening, and it was quite a stressful situation for everybody involved. They did have family in the country, but they couldn't be there until later that night. So they asked me to go in and see if he would respond to some music. I tried a few different things on the guitar and some singing. It was really clear what he didn't like, and I eventually settled on just some instrumental playing that seemed to help with his restlessness and agitation, but it was not really effective. So later on that afternoon, I was in the room when the nurse was speaking to his son. So I told her to ask him what music he liked. And the son got really excited about that because this man had actually been in Highland pipe bands for most of his life. And the son was a musician as well, so he was really excited to hear that we would be using music. So we were able to set up. I don't have any bagpipes myself, so we found some music on Spotify and set it up with a Bluetooth speaker in his room, and just put that on to provide something that was familiar, something that he had this huge bank of memories and emotions associated from his whole life playing that type of music. Yeah, and you can see how that may help to distract him or interfere with that pain signal. And the reduction in isolation in that instance was enormous. You can imagine being in pain, being somewhere unfamiliar, not knowing anybody, not trusting the people around you to be able to manage your pain because they haven't been able to so far. But then you hear this familiar music that you have all of these fond memories associated with. Encouraging meaning physical activity. As I mentioned, some people like to play instruments themselves, or some people like to dance, or their families will dance in front of them, or dance along with them, or just clap or play a little bit or something. I had a really interesting session not too long ago as well with someone who had become deaf, blind, and dumb, and I received a referral because they had been a saxophonist. So I don't have a saxophone, but I took a few instruments in there, and we passed them a ukulele, and they played along and had a little play around, but then put a guitar in their hands, and they immediately responded, and their whole body set up, and they started playing along and played for about 10 minutes. We didn't know what they were playing, but it was obvious to me and the family members present that they were, in their heads they were singing along and playing along just as they used to. And I know that was a really, really meaningful experience for the family there. I left the guitar there with them to use in the future. I'm not sure they did, but yeah, that was a really significant moment for them. The line there about modulating activity in multiple limbic and paralimbic structures, that's to do with how pain is involved in a number of ways in our brain, including our emotional response to pain, dopamine pathways that are responsible for pleasure, the formation of memories, and the area which regulates hunger, thirst response to pain, as well as our pulse, blood pressure, breathing, etc. These processes are all affected by or involved in our experience of music as well. So if there's activity occurring in that area of the brain due to the experience of pain, if we can provide some musical stimulus that promotes some different activity in that same area of the brain, then hopefully that can reduce their perceived experience of pain. The enhanced meaning or imagery or expression of identity is used more, well, I'll go on to the next slide actually to discuss things. Here at the top we can see distraction. So we can all use distraction as a way to help us manage our pain, and we can do this with any recorded music. I often have discussions with people, if I can't see them regularly or they're just in the inpatient unit for a brief period, that once they're home again, they can use music to assist with their pain management. A lot of us do this instinctively. A lot of people that I talk with are already listening to music really regularly or have been listening to it in the hospital. Yeah, that's very common. So I just encourage them to continue with that and want them to know that it is recognized as a way to help manage pain. And I don't advocate that it replace their medications or, do that instead of other interventions. But tell them that it can help them, reduce their need for medications due to breakthrough pain or help them cope with their pain until their next medication is due. Yeah. And so as we move further down this list here, it gets into more complex music therapy techniques, I suppose, that we use. MTE would be down the bottom in the transformational area, and the cathartic, expressive, or existential would be things such as songwriting and or improvising. It can be very powerful as well. If people are able to improvise and express how they are feeling, that can have a really profound effect on them afterwards and can really help them to get through what they are experiencing. And again, people don't need to be talented musicians to improvise. They can be improvising on a drum or a xylophone or with a stringed instrument, playing with the strings open. There are many, many different ways to be expressive on an instrument that don't require years and years of training. This last little section, I just wanted to acknowledge that there are more recent studies that look actually into how the brain processes that are occurring while we experience pain and while we experience music. And there is good evidence now that the pleasure we experience when listening to music operates on the same opioid pathways that our medications we use to assist with pain work in. And so the pleasure we feel when listening to music can really reduce our perceived experience of pain. There is also evidence looking at the difference between processes occurring when we are just listening to music versus when we're doing music therapy entrainment. Both have a demonstrated effect of reducing our perception of pain, but they work in different ways and in different areas of the brain. As I mentioned earlier, it's really important that the music used is meaningful to the patient. So if we're encouraging people to use music as part of their pain management strategy, they need to use music that generates that pleasure for them. We can't prescribe a particular type or style or song. There's also evidence that live music can be more effective than using recorded music. And I'm sure everybody listening has been to concerts and experienced live music, and how captivating and affecting that can be compared to listening to something. I always strive to make our patients aware that music can be used. As I said, people often use it instinctively, but once they are aware that is an evidence-based strategy, then they may be more inclined to use it more often and to believe in it and to just benefit from its effect. So I'm not advocating that we replace the array of medications we use to assist with pain management, just acknowledging that music can assist in this process. Also, there was a meta-analysis conducted in 2016 by Lee, looking at 97 different studies investigating music and pain. And this revealed that music interventions had statistically significant effects in decreasing pain on 0 to 10 scales, reducing emotional distress, reducing anesthetic use and opioid intake, reducing heart rate, systolic and diastolic blood pressure, and respiration rates. We also know that it can reduce cortisol levels, which is the stress hormone, so assist with anxiety and restlessness and agitation. Please, when you are working with people who are having difficulty managing their pain, consider encouraging them to listen to music or use music or find live musical experiences that may help them manage their pain in the future. I don't have a song to finish with, but I wanted to just note this song by the Ramones, that I Want to Be Sedated. I hope some of you will be familiar with it. And this song was actually created out of a painful experience that Joey Ramone, the lead singer, had some kind of homemade humidifier that he used before concerts. It actually exploded before a concert, and he burnt his chest and his lower face, I think. And he carried on with the gig and didn't go to the emergency room until afterwards, but obviously that was a hugely painful experience for him. And out of it came this really popular song that many of us will be familiar with. So that's my presentation finished for today. Thank you everybody for listening,